Well, Republicans have been talking about their health plan, the effort to repeal the Affordable Care Act. For the past week, they've been trashing the Congressional Budget Office, the nonpartisan group that offers analysis of the impact of the bill. So no surprise yesterday when that analysis came out, they trashed the CBO, did not take them long in doing so. Secretary Tom Price of Health and Human Services came out and he said flat out that they strenuously objected to the report. CBO says next year, if the Republican plan is passed and signed into law, there will be 14 million more uninsured Americans than under the Affordable Care Act. Now, they arrived at that number by saying that the number of people who are going to lose Medicaid plus the individuals who will lose their employer's insurance plan. Now, it also says premiums for individuals will increase by 15 to 20% before there will be any decline in costs. Now, Republicans have been touting this particular plan in a huge way because they say that it's going to lower the deficit by nearly $400 billion. But if you break down the numbers, the folks who will be most impacted are going to be the rich. They will see a massive tax cut. Now, by the year 2026, 24 million more Americans will be uninsured than they would be right now under the Affordable Care Act. Okay, that's first and foremost. Democrats who were angered at Republicans released the health care plan last week without having it scored by the CBO, believe the report should be a wake-up call for the party.
Today, the nonpartisan scorekeepers have spoken clearly. Trump care means higher costs for less coverage. The CBO report should be a knockout blow for Republicans in Congress.
How can they look their constituents in the eye when they say to them, 24 million of you are no longer going to have coverage? And those of you who do have it will have less in terms of coverage at more cost to you.
Now, the White House immediately rejected the CBO's findings. Health and Human Services Secretary Tom Price called the projections, quote, virtually impossible.
Disagree strenuously with the report that was put out. We believe that our plan will cover more individuals at a lower cost and give them the choices that they want, for the coverage that they want for themselves and for their family, not that the government forces them to buy.
All right, folks, joining us by phone from D.C. is North Carolina Congressman G.K. Butterfield. Also is Congresswoman Sheila Jackson Lee. First and foremost, Congressman Butterfield, I want to go to you. So, it's interesting, when you go through the numbers, when you see that the Republicans want to offer this tax credit to folks in order to get health care, but it doesn't even come close to matching the subsidy under the Affordable Care Act. The rich, though, will pretty much get the exact same thing. They will get essentially a massive cut as opposed to those folks who are older and those folks who are poor. What's amazing that the people who are going to be hit hardest by this are folks who actually live in Trump country. I'm just wondering, why would those folks somehow think that this is a great plan for them?
Roland, are you talking to me? We went dark for a few seconds.
Yes, talking to you about this, the CBO's analysis of this health care bill.
Well, we knew all along that the CBO score would not be favorable to the Republicans. The Kaiser Family Foundation a few days ago issued a report that they thought 15 million people would lose their insurance as a result of Trump care. And yesterday it simply confirmed what we already knew. Look, a wrecking ball is in progress. And the American people need to pay attention to this because we're going to lose the Medicaid program completely in 2020, at least the Medicaid expansion part of the program. Those who have employer plans are going to see a scaling back, and many of those are going to lose their insurance. 14 million more people will be uninsured by this time next year. 14 million. By this time next year, by 2020, 21 million people uninsured. By 2026, 24 million people uninsured. This is Trump care at its worst, and we've got to pay attention. We've got to apply pressure to the policymakers, and you need to call your congressmen and senators and let them know that this is not good for your family.
Congresswoman Sheila Jackson Lee, when you go through the numbers, when you go through the CBO report, first of all, Republicans are saying it's worthless, yet these were the same people who were leaning on the CBO in previous years under President Barack Obama. When you look at those numbers, Republicans say, well, this is only the first of 3 phases and then these numbers are, you're not going to have all the people who are uninsured. Do you believe them? All right, then. I'll go back to Congressman G.K. Butterfield. Looks like we've lost Congresswoman Sheila Jackson Lee. When you hear that, Congressman Butterfield, that, oh, well, you've got, this is the first of 3 phases, and then it'll be all fixed when it comes to regulatory reform and tort reform. What do you say to that?
Well, each phase is going to get worse and worse, and when it's all added up, it's going to be more than 24 million people 10 years from now without health insurance. Look, we've got to go into a proactive stance. The Medicaid program is on the chopping block. What they want to do is to get out of the Medicaid business and give the Medicaid program to the states, and we know what happens there. It's going to probably be around a 40% cut in the Medicaid program. Governors and state legislators are not going to have the money to administer the program, and so what are they going to do? They're going to cut back on benefits. They're going to cut back on who's eligible for Medicaid, and then they're going to cut the reimbursement for medical providers. And so it's going to be a wrecking ball for low-income populations across our country, not just black folk. But I don't know if you saw Bernie Sanders on MSNBC last night, but he was over in cold country, and they are scared to death.
But this is what stuns me, and I want to bring in Dr. Robin Armstrong, a former Texas GOP vice chair, joining us via Skype from Friendswood, Texas. Dr. Armstrong, you there? Dr. Armstrong, are you there?
I've got the best connection. I've got the best connection.
I got you, Congressman Butterfield.
Yeah.
Dr. Armstrong, okay, well, first of all, so I want to pick up on that point, Congressman Butterfield, which is stunning to me. And that is, you mentioned this panel last night on MSNBC, and I listened to it driving into the city. And I listened to all these white working class folks talk about how they cannot afford to lose the Affordable Care Act. Talk about how they don't believe that Trump is going to do anything about the opioid crisis that's affecting them in a negative way. But they all voted for Trump.
Yeah.
And you sit there and you go, this is what the man said he was going to do.
They didn't think it was going to apply to them. Now they've got buyer's remorse, and I think the Trump supporters are finally realizing that they don't have what they thought they have. Let me tell you, the next 4 years are going to be very difficult for poor folk. Rich people are going to laugh all the way to the bank because all of the tax cuts that they're going to derive from this new legislation, if it's passed, will be tremendous. But let me tell you, I don't believe it's going to pass because I believe that good folk across the country, many of those are listening to this program right now, are going to call in and say to their senators, hell no, we're not going to go back. Obamacare may not have been perfect, but it brought hope and opportunity and coverage to millions of our citizens, and we're not going to go back. We're going to fight this thing every step of the way. And the Republicans just rolled this thing out last Monday night at 6 o'clock. It had been sitting under lock and key for 2 months. They rolled it out on Monday night at 6, and on Wednesday morning we started marking up the bill, and we went 27 and a half hours fighting the Republicans every step of the way. And now we've got to fight them on the House floor. We've got to take this fight to the Senate.
Congressman Butterfield, let's also go deeper into these numbers. When you begin to look at the subsidy, Republicans will offer what they say is a tax credit.
Yes.
Okay. But it doesn't even compare to the subsidy. You also lose the individual mandate, which also means that according to their plan, according to the CBO, folks who have health care, some people who have health care from their employer will lose that.
That's right. Well, first of all, the law does away with the individual mandate, and that's terrible because that's the way President Obama constructed this thing. So everyone has to play. Everybody's got to pay into the pool, so that the more aged person will get the benefits, while the younger people will help fund the system. When the younger people get older, then they get the benefits from it. The more people who are in the pool, the better it is. And the way we constructed Obamacare, we would give a subsidy to middle-income folk to purchase purchase insurance. If your insurance is $800 a month, the subsidy might have been $550, and it has worked reasonably well. Yes, there have been some bad outcomes, and we need to fix those, but it has worked well. They're going to scrap that. They're going to scrap the subsidy completely and tell folk that you're on your own. They talk about freedom. Freedom to them means buying your own insurance, and what they want to do, Republicans, is at the end of the year you can have a $2,000 tax credit on your income tax return. That's why so many folk are going to lose insurance, because they're not going to be able to afford it.
All right, Congressman G.K. Butterfield, we appreciate it. Thanks a lot.
Thank you, Brother Roland.
All right, let's go to our panel right now, folks. We have Wilmer Leon, the third, of course, with Sirius XM radio show host, also author of Politics, Another Perspective. We also have Dr. Avis Jones-DeWeaver, she, of course, a leadership strategist and author of How Exceptional Black Women Lead. I'll start with you, Wilmer. It's quite interesting when you look at these numbers. The Republicans spent a long time trashing the CBO numbers because they knew what the CBO was going to say. Now all of a sudden they say the numbers are horrible, yet Speaker Paul Ryan then sends a statement out saying, well, no, they're right, they're correct. But it was also amazing, they're embracing the deficit reduction numbers of the CBO but rejecting the rest. If you reject the other stuff, well, the deficit numbers are a lie too.
Well, Roland, here's something that I think people first need to take into account is that the Republicans have been railing against the Affordable Care Act for 7 years. And then they had the opportunity to put something on the table and they had absolutely nothing. Donald Trump ran against the Affordable Care Act for 1.5 years. When he became president, he had nothing to put on the table. And so I think the real story here is the fact that when you look at the conservatives that are railing against their own bill, why are they railing against it? Because in their minds, it doesn't go far enough in repealing subsidies, and they hate subsidies. And also, they don't want the delay in the rollback of Medicaid funding till 2020. They want to roll that back now. Why? Because they see it as a subsidy. I think that is really what's at the crux of this whole Republican intent, and that is what people really need to be paying attention to.
Avis, everybody keeps talking about the 24 million uninsured, which I totally understand, but that 15 to 20% increase in premiums is, to me, a bigger issue because all you've heard from Republicans trashing the Affordable Care Act is the increase in premiums.
Absolutely. And what they don't tell you is that if there were no such thing as an Affordable Care Act, other studies show that, of course, health care premiums were rising anyway prior to the ACA. And there's some projections that if the ACA was not initiated, the raise in premiums would have been higher than what we've actually experienced under the Affordable Care Act. Here's what their real problem is with the Affordable Care Act, as Leon so brilliantly laid out. But at the heart of it is the fact that they call it Obamacare, and the root word of that is Obama. And we have to remember that the only thing that they did for 8 years was to say no, no, no to anything attached to President Obama. And now that they have the chance to actually go and put forth an idea, a solution to a problem that President Obama was able to address when several other presidents prior to him was not ever able to do it, their solution clearly falls woefully short and leaves Americans of every stripe significantly worse off.
A peaceful protest turned deadly. 37-year-old black man was shot and killed by Baton Rouge police. His hands are in the air, and you still get shot by the cops.
Oh my God, please don't tell me he's dead.
We're not gonna let hate define us.
Race is a big part of this.
If truly all lives matter, then all lives need to matter equally.
What we require is action. What we require is accountability. We understand that black lives do matter, and we will keep focused on this issue.
NewsOne Now, every weekday morning at 7 on TV1.